understand the mind chapter of Repertory? Understood? Never. Even if you are 50 years old in homeopathy, it will go above your head. So first, there are two things: sensation and perception. These are the two words you should begin your study with. Now let's say you are entering a kitchen, correct? A kitchen of Keralite mother. And then you smell upma or poha or idli or sambar. And when the smell of sambar comes, you say, this reminds me of my mother. This reminds me of my grandmother's recipe. This reminds me of my auntie's recipe of sambar. Do you say like that or not? Yes. That is sensation. Why sensation? Because you are using your nose, you are using your smell, and then you are correlating that with an object which you knew previously. Or suppose you are eating dosa, and while eating the dosa you say, oh, but this reminds me of so and so dosa in so and so place which I used to have with my father when he used to take me for breakfast on Sunday. See, you correlated so many things. So that is sensation. Have you all understood sensation? Can I proceed further?
Yes.
So we now go to perception. Now perception is what you feel. Correct? So suppose you enter the house of somebody, you ring the doorbell, the person opens the door, and the dog comes running and jumps on your body. Correct?
Yes.
One perception is trying to attack you. Yes or no?
Yes.
But the opposite perception also, that he is very happy to meet you and he is excited. Do you agree?
Yes.
So how many perceptions? So you can have multiple perceptions for a given situation. Do you follow what I mean? So a perception is a feeling that you develop when there is a stimulus, there is a situation, and you interpret that situation according to your thinking, either from the past experience or from your knowledge, anywhere it can come from. Like as I told you, a dog who is coming on your body. Some people will scream, shout, faint, and have a heart attack, thinking that a dog is attacking me, right? Some people will start playing with the dog because he knows that dog loves him a lot and he's so happy. So that's the perception. So delusion is usually a combination of sensation and perception, but it's in a little different way. It's not the same way. Which does not exist, you have perception of that. So for delusion, the reality should be absent. Now if I see this gentleman sitting in front of me with a blue shirt, it is a fact. It's a perception, but it's a real perception. It's not a delusion. I am seeing a man with a grey hair and a blue shirt. No, it's not a delusion. But if the chair is empty, and if I say there is a man with a blue shirt sitting in front of me with a grey hair, it's totally delusion because it is non-existent. Have I made this very clear? Any doubt? So now we go to the enlarged. So what is enlarged? Perception or sensation? We will call this as a sensation to begin with, right? Because my body is enlarged, I cannot remove my bangles, my finger is enlarged, I cannot do that. so many things, correct? My head is enlarged, I cannot wear the hat. My body is enlarged, I cannot wear my sari. You can say many things. Now there is, in the medical world, if you have a mobile phone, all of you can see Alice in Wonderland syndrome. There is a syndrome known as open. Alice in Wonderland syndrome. Have you heard of this story, Alice in Wonderland?
Yeah, so the movie also.
Good. So please see in your Google or whatever you are seeing, Alice in Wonderland syndrome. You got it?
Yes.
And what does it say? Can anybody read it?
Alice in Wonderland syndrome describes a set of symptoms with alteration of body image. An alteration of visual perception is found in that way that the sizes of body parts or sizes of external objects are perceived incorrectly.
Exactly, Borista is there in Alice in Wonderland syndrome. Now, good. You are good. You are correlating this enlarged sensation now with the disease process. So now we have to understand what is the disease, what is the condition of the patient. And here there are multiple factors. There are two things: organic factors and functional factors. Now let's see. Let us take a situation when there is an examination in the hall, correct? Exam is going to take place in next half an hour. You are outside the hall. What does normally students do? They have a book in their hand and they revise. But during that half an hour, whatever you read and revise will be quite different than what you read and revise 1 month ago in the library. Which will enter your brain faster and permanently? The one outside the hall or one in the library 1 month back? I read that. Outside the library. And why? Why over there you keep on reading and you don't remember many things? You will remember. I won't say you won't remember anything, but you will not remember all. Why? Because you are under severe anxiety of performance, right? So during anxiety of performance, you learn one thing, that you cannot read properly. If you read properly, you cannot remember properly. If you remember properly, you cannot grasp properly. All your faculties are
Down.
down. Now, if your other faculties are down, you will not be able to see properly, you will not be able to hear properly, and you will be not able to write properly. So let's say there are only 2 minutes remaining for answer paper, and you just start answering the question. You know the answer. Will you be able to write it properly in the last 2 minutes? No. Because an examiner will keep on shouting, no? Last 2 minutes, I will collect your paper. Last 2 minutes, I will collect your paper. Yes or no?
Yes.
Will you be able to write? But you have a good hand, you have a good ball pen. Why you should not write? Anxiety. So in anxiety and stressful situation, our sensations do not work properly. Either you are not able to see properly. Let's take a common example. You had a very bad fight with your husband. You take a car and go out. What will commonly happen? Accident. Why? But you have a normal vision. You have a normal vision. The car is good, but still you will have an accident. Or you had a fight with somebody and you are walking on the road. You don't see the signal properly, or you don't see the footpath properly, and you fall down. See, your vision is affected. So, one of the reasons of enlarged sensation and abnormal sensation of the body image is severe stress and anxiety. Understood? The second organic reason is the degeneration of the brain, vascular insults of the brain. That is the situation in which you get all these things. Have you followed? So Bovista covers all those things, the psychological part also very nicely. And now we will understand the psychological part. What makes Bovista feel this enlarged sensation? And what is wrong with Bovista psychologically? For that, I will show you one rubric. Can you read this rubric which I have pointed? What is the rubric? Read. What do you feel when you read this rubric? What do you feel? Huh? How many patients in your life you have seen who are laughing with ha 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 with customer?
Never.
Yes or no?
Never seen it.
So my friend says never. If you have seen in Kerala, let me know. I will show you one rubric. Then, let's say another rubric will be absent-minded in urticaria. How many people you have seen with urticaria absent-minded? I have not seen. Then I will show you awkward urticaria. There is no awkward in urticaria. Let's see. Aversion to everything in urticaria. Then maybe sensitive in urticaria. So these are the rubrics which you don't see in your practice. Correct? Yes or no?
Yes, sir.
But if you understand these same rubrics with a metaphor, you will say yes, it does exist. Now, let's see, somebody comes. Can you just put the power? My laptop. Thank you. So let's say somebody comes with asthma to your college, correct? And you ask him, why did you come? And he said, my wife asked me to go to hospital because yesterday night I was coughing, but I don't feel I was coughing. See, what is that man telling? I don't feel I was coughing. My wife said I was coughing, so I came. You examine him, lot of bronchi. And then you say, but there is too much bronchi, too much bronchospasm in your lungs. I think so your wife is right. No doctor, come on now, I don't think I have anything like that. I just came to make my wife happy. Laughing with her stomach. Understood? Because he doesn't see when do you laugh on funny things, correct? On funny things. He feels that his asthma is very funny. So I start laughing. You can also take another rubric. Well says when he is very sick. You can also take that rubric in this situation. Well says then he is very sick. Or you can use the rubric fearlessness because he has no fear. He has no fear. So multiple interpretation can be given to this situation. One of them is laughing with asthma. So like that, many times the third entry point in Boista is they don't realize the seriousness of the situation and they laugh it off. Thinking it is not something very major, thinking it is not very dangerous, and so it's like a, or you can use the rubric frivolous, like belladonna. Many patients will come to you, oh doctor, I have got severe pain in my right knee. Good. For how long? Since last 1 year. But why you come today? Doctor, I was always thinking of coming to you. But you know, something or the other happened in my life and I never came. Good. Frivolous. Belladonna is the remedy for such patient. Because he is so frivolous, since 1 year, he has a severe pain in the knee and he comes only today to your clinic. So if you see the rubric over here, frivolous, there are 38 remedies, but belladonna is there. You understand? So many times patient comes and says like that. Or there is another rubric with the same situation, shrieking, unconscious, or you can look over here, shrieking, alternating with unconscious, or shrieking with unconscious. What is that? You are also the same thing. I have a severe pain in the knee since 1 year. I was thinking that I should come to you, but something or else happens and I did not come to you. Then why did you come today? Today the pain is so severe that I cannot get up from my bed, and so I decided. So all this time he was unconscious, and today he is shrieking and shouting for his pain. And that is why many times you have to interpret in this way, in a metaphoric way. Every time in mind, it is not very easy to apply this kind of rubric. Understood? So you have to use your knowledge of metaphor, you have to use knowledge of symbolism to understand this kind of rubric. We go further. So Bovista is a very good drug for urticaria. But if you want to locally understand urticaria of Bovista, what is the common modality? What aggravates Bovista urticaria? Since you said you have learned Bovista in your college, let me see how good students you all are. If I remove the chapter of urticaria for you, loudly, loudly. If you want to answer, say loudly. Yes? Loudly. On experiment. On experiment. Okay, any other modality? Bathing. For me, the most important modality for urticaria in Bovista is bathing. I will show you. If you don't trust me, I will show you. So, okay. Now, the fourth entry point of Bovista. Have you all written this? Yes? Let me check your excitement also. I have to check. Yes, you are right. Excitement is there. Okay, now we go to another entry point. So, cheerful company in. That's Bovista. Can you see this? So, cheerful in company. Now we will study everything about the word company. Correct? So, when will you use this? Let's say you are in a house and your mother says, can you go to the market and buy a packet of Surf Excel? And what you will do? Immediately you will take your mobile, open WhatsApp, and you have a friend known as Jayashree. Jayashree, I am going to market. Would you like to come with me? And then Jayashree will say, for what? Surf Excel. Come fast. In 2 minutes, meet me down. This is a real example I am telling you. One of my girl and the mother used to say, doctor, she always wants company. You know, she doesn't do anything without, company. And then when I asked that girl, why do you always want Jayashree? She says, I'm so happy with her. If she is there, no, I'm very confident, I'm very happy, blah, 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 blah. And she had a very bad eczema. The main complaint why the mother brought the girl to me was eczema. In Bovista, everything went away. Because she had this kind of characteristic symptom. So, cheerful in company. And then you look over here. Indifference, company ameliorates. So, indifference, company, where is company? Where is that? Company, society.
Perhaps alone, then company ameliorates.
Yeah, so this is there. Indifference, company, society, while in ameliorate is Bovista. Then they love picnics and parties, so we will say social meetings ameliorate. Bovista, can you see Bovista? So social meeting ameliorates. And then you can also look company desire. I will show you Bovista. Where is Bovista? Yeah, yeah. Can you see? So if you look over here, everything to do with company is a very important entry point into the remedy when you should start thinking of Bovista. If somebody talks of, now see, if you want to buy a Surf Excel, a shop below your house, and you are calling Jayashree, please come down in 5 minutes. And the mother showed me the WhatsApp from her mobile. Look, doctor, this is what she is. Even if she has to go anywhere, she will phone some of her friends. It's not always Jayashree. If Jayashree is not in the house and does not respond to WhatsApp, she will not leave the house. She will tell the mother, Mommy, I'll go after 10 minutes. Mommy, I'll go after half an hour. Like that. So this is important. Then another entry point is anger. So anger, alternating with exhilaration. you will see Bovista. So, anger alternating with cheerfulness. So how is this now? How do you get this symptom? Very simple. The patient wanted Jayashree to go down and buy Surf Excel, correct? But when she is buying Surf Excel and chit-chatting with Jayashree, the mother phones, come up immediately, your father has come. Exhilaration with Jayashree, now angry with the mummy. मम्मी ने यार बीच में टांग मार दी, फोन करके ऊपर बुलाया. You follow? So this is anger alternating with exhilaration or cheerfulness, because I was going for a movie, going to do shopping, going to some place, and then mummy phones me, daddy is calling you urgently, or we are going out, you have to cook the dinner for us, so come home immediately. But mummy, I am with my friend, leave your friend and come immediately. Angry. The patient is angry. Anger alternates with exhilaration, cheerfulness. So many times you would have also seen that you are busy with something, or you are also meeting your boyfriend or girlfriend, and your parents call you immediately, come home, your tuition teacher has come, your Kathak teacher has come, your relative has come, and they want to see you, and you are so angry with your mother, sometimes you may not even lift up their phone. I know your things, I remember. Because many times on Wednesday afternoon, every Wednesday afternoon I go to cafe coffee day shop to drink coffee, because I meet many of my homeopaths over there, and they want to discuss with me their difficult cases. So once we were all sitting over here on a table. There is a table of 6, and then there is a table of another 6. And one boy receives a phone call, and we were just chit-chatting. We had not yet started our discussion. We are waiting for the coffee and some savories to arrive. And then that boy is telling, Mummy, I will be late. I have a science experiment and I am in the laboratory. Oh God. He was in coffee day, drinking coffee with some girls, you know. So anger alternating with cheerfulness. I said, I should give this boy Bovista. I should. So, like that, these things do happen. So, I showed you anger alternating with acceleration. Yeah. Then irritability also. You can even go to irritability. So, irritability alternating. Why this happens? Any idea?
Is it on? Make it on.
So, irritability alternating with cheerfulness is also Bovista. Yeah, Bovista. So either you become irritable. So if mummy phones you once, it's irritable. She keeps on phoning you many times, anger. And then you can speak lies or you can run home, it's your problem. And then, what will happen? You go home in a which mood? Angry mood, correct? Because mummy has called you, because you left Jayashree high and dry. So anger, and then when mummy says, come on now, you have to make the dinner. So anger with work aversion to is also Bovista. You don't want to cook. You don't want to cooperate with your mother. You saw? You don't want to work. But, now see something best. So, mother has called you for the work, correct? You started, you don't want to make dinner, correct? You are angry with your mother, aversion to work. And the mother said, okay, we are going out, we will come after 3 hours. Then what she will do? take the mobile, WhatsApp. Jayashree, just come up, mother is not there. I have to make dinner. Come and give me company. And then she is so happy to work with Jayashree that another rubric will come. And that rubric will be anger, activity with great physical. There has to be Bovista over here. Or let us say anger with, let me show you one more rubric before that. Irritable. Anger with increase physical activity along with platina. There has to be a Bovista. It's missing in the repertory, but it is there in the proving of Bovista. That when the company comes, she is so happy and she wants to work and will make the best of idli and dosa. When the mother comes, she is so happy because before the mother comes, she tells Jayashree, now you go, if my mother sees you up, she'll get angry on me. That is what the game many times Bovista people can do. But there is another also rubric which I wanted to show you. Anger, work cannot. So maybe work cannot. Here also, along with calcaria phos, you can add Bovista because Bovista also has the similar thing. Okay. Now we go to another entry point of Bovista.